Great job completing this Agon Rescue training session for emergency situations related to anaphylaxis. Now that you have a practical understanding of this scenario, let's take a quick look at key elements that are important for success.
Hello there, team. I am May at Virgilia, and I'm going to guide you through a couple of slides today. Anaphylaxis is a severe, life-threatening allergic reaction that occurs rapidly after exposure to an allergen. It can be triggered by foods, insect stings, medications, latex, chemicals, or other substances. This is, for example, why you need to wait for half an hour after receiving vaccines. First, skin reactions. Anaphylaxis often causes hives, intense itching, redness, or a rash and swelling, particularly around the face, lips, tongue, or throat. Next, respiratory symptoms. Difficulty breathing, wheezing, and swelling in the throat or tongue are common and dangerous signs of airway obstruction. Circulatory symptoms. Anaphylaxis can cause a drop in blood pressure, leading to dizziness, fainting, or a weak or rapid pulse. The skin may appear pale or bluish. Gastrointestinal symptoms. These can include nausea, vomiting, abdominal pain, and sometimes diarrhea. Finally, other general symptoms. A person may feel anxious, have a headache, or become unconscious in severe cases. These symptoms can appear quickly, so if multiple signs occur, especially after exposure to an allergen, it's critical to act fast and get medical help. Let's take a closer look on what we did observe on the training session you just completed. At the early stages of the development, we observed that the victim reported mild pain, along with signs of irritation. As time progressed, the symptoms became more moderate, with a decrease in oxygen saturation and an increase in the victim's breathing rate. By the end, the circulatory and respiratory systems had deteriorated to the point where the individual became less responsive and eventually lost consciousness. Let's look closer on great success factors during this incident. First and foremost, call for an ambulance. They will be able to give medical advices and also ensures swift access to supplemental oxygen, and the ability to administer epinephrine are critical life-saving measures. So it is advisable to call for help at the first sign of worsening symptoms or as soon as it is identified that this could be an allergic reaction. It is important to gather as much relevant information from the patient as early as possible. Time is crucial in emergencies like anaphylaxis because the reaction can progress quickly, leading to severe complications or even death if not addressed immediately. Every second counts in administering epinephrine, securing the airway, and providing necessary support. It's also important to ask critical questions as early as possible. Gathering information about allergies, symptoms, and previous reactions can guide treatment decisions. Use your time wisely, take advantage of being a team, tackle multiple tasks at once, and make smart choices to save time. Have one person meet the ambulance before it arrives and open any gates to shorten the walking distance. As we assess a potential anaphylactic reaction, here are some key questions to ask. First, identify the trigger. Ask what the person ate or came into contact with right before symptoms started. Did they have a previous allergic reaction to something similar? Next, check for symptoms. Ask if they're having trouble breathing, swallowing, or experiencing swelling in the face, lips, or throat. Are they showing any rashes, hives, or itching? Then, gather medical history. Find out if they have known allergies, asthma, or carry an epinephrine autoinjector, EpiPen. Have they used any medications recently? Assess their condition. Ask how severe their symptoms are. Are they feeling dizzy, lightheaded, or having chest or abdominal pain? Finally, determine if treatment has been given. Has anyone already administered epinephrine or called for medical help? These questions will help you quickly evaluate the situation and determine the next steps. It's often helpful to ask the patient to rate the severity of their symptoms. While this may be somewhat subjective, it provides a useful way to gauge the progression of their condition. Be sure to take note of any important information, and it's essential that relevant details are communicated to the team leader. Oh, and a really important factor. Make sure to update the ambulance dispatch center. This information is crucial for the hospital as it allows them to be fully prepared to handle the patient upon arrival. Thank you for your participation. I hope you now have a better foundation for handling similar situations in the future. Goodbye.
If you and your group have the opportunity, I'd like to give you a small challenge to discuss. To what extent should you prioritize your own safety? And is it likely that others might need medical help as well? If the person who was with the patient before the rescue team arrives suddenly starts feeling unwell, how can we rule out infection? Good luck!